Hi, I'm Dr. Scott Greenberg from Greenberg Regenerative Medicine. I'm here to show you some scapular stabilization exercises. This is really important when we see patients who have shoulder problems, rotator cuff issues, osteoarthritis of the shoulder, or any neck and head issue, even related to concussion and headaches. Because if your shoulders, which should be like this, are like this, it's going to pull from the neck all the way up. And this can produce headaches, dizziness, cervical cranial problems, and we want to keep everything nice and square and level. Now, the reason why this happens is because the pecs get too tight and the muscles in the back called the rhomboids, which are between the shoulder blades, are too weak. So I'm going to show you some exercises now to stabilize your shoulder blades, which helps to rebalance the muscles. And if you remember from a prior video, I showed a ball exercise across the chest to try to loosen the pecs. So this is also going to try to loosen the pecs, but it's for something going on back here in regards to the strengthening. In addition to that, when patients have done this for years, we've seen people go from a posture like this to a posture like this. Because if I tell you to stand up straight, you can only stand up straight for a short period of time. But if we build the muscles that are causing you to slouch over, you're not going to slouch anymore. So here's the first thing I'm going to want you to do. And in something like this, form is so much more important than your strength. So I don't really care how hard you pull it, but I want to make sure you do it right. And with this, you're going to keep your elbows pinned against your body and pull out. And I'm not trying to pull out so fast or pull out so far. And this is a pretty hard band, but I'm keeping my elbows in and I'm going slow and controlled, okay? Furthermore, we can do exercises like this, where we go on the diagonal, okay? And this, again, helps to build scapular stability. Now, the reason why I have this band is because for many people, this is too much. And this is like a really, really, really thin band. But again, if you look, again, you hold it upside down, palms up, nice and easy pulling. Again, working the muscles between your shoulder blades, okay? Now, the other exercise I'm going to show you, I'm going to call it the trash truck. Because what it is, it's emulating like when a trash truck goes and picks up a dumpster and dumps it in the back of the trash truck. So here, you're going to keep your arms at 90 degrees. Again, you have the band with a little bit of tension. Some people, especially in the beginning of this exercise, can't do it with any band whatsoever. And what you want to do is to lift your arms straight up and straight back. Nice and slow. And this helps to work on the scapular rhythm. Now, when patients are really weak, they may be only able to go this far or this far. But what I'm really trying to prevent is your elbow going out. So I'm going to show you what that looks like, and we're going to use the heavy band, which is a lot more difficult. I'm going to put a lot of tension on it. And now, when I try to lift up, as I get to here, my elbow's starting to flare out a little bit. And that means it's just too much for me. But if I do it with just a little bit of tension and try to concentrate on my form, I can do it without my elbow flaring. So it's really important to do these exercises without a flare of your elbows and work these different things. And this helps to, again, strengthen the muscles back here in your rhomboids. The stronger the rhomboids are, the less the pecs have to overfire, the more your shoulders will stay level.